I've always liked to find solutions to problems.
The minute he walked in the room, I looked at my husband and I said, he's our doctor.
What's important in looking for a plastic surgeon is that you look for someone who has a proper background, is board certified by the American Board of Plastic Surgery, and is really specialized in the procedure that you do. My name is Granzow, and I'm a plastic and reconstructive surgeon. I have a board certification both in ENT, which is head and neck surgery, and plastic surgery together. Both fields really require that you have great attention to detail. I specialize in microsurgery. Typically we'll focus on breast reconstruction or reconstruction for lymphedema.
What Dr. Granzow is doing is life-changing. He's absolutely amazing.
Women have a lifetime risk of getting breast cancer that's about 1 in 8. Some of the cancers are more advanced, which requires reconstruction. That's when I would come in.
I'd already gone through the whole cancer bed. I did 4 months of chemo, then had my breast removed.
I had breast cancer. Dr. Granzow came in on his day off. He spent 3 hours that day talking to us.
If you need a mastectomy, if you need a more extensive treatment, I can take tissue from your body, wherever you've got extra, and take that tissue that you normally say take away with a tummy tuck, replace it in the breast, so in the end we'll have something that looks like having had a tummy tuck and a breast lift. I like to focus on making that reconstruction make someone look even better than they did before they ever had their breast cancer. They can look absolutely fantastic, and they'll really feel good, and they'll feel better and excited and have an even broader outlook on life.
I had bilateral mastectomy with reconstruction. He made everything so easy. We had photos, we had drawings. Everyone at the hospital was great. It's been a great process.
One of my major interests is lymphedema surgery. What is lymphedema? That's a swelling that you get in an arm or a leg, usually after treatment for cancer where lymph nodes have been removed. It's a condition that didn't have a surgical solution just a few years ago. Now I can move lymph nodes from another part of the body and recreate and replace those lymph nodes that have been taken away.
I did 4 months of chemo, and then they said, well, you need to have a hysterectomy. Your cancer thrives on estrogen. I wake up from that surgery and my fingers are all swollen, my upper arm is swollen, and I'm told I have lymphedema. I have to wear a compression sleeve, I have to wrap my arm at night. I couldn't garden anymore, I couldn't walk my dog. I couldn't shoot my gun anymore as a police officer. So to have the surgery, absolutely life-changing.
If the arm has come to a more solid state, we can do a very specially adapted version of liposuction. This allows us to really get rid of that volume for someone who might have an arm or leg that might be 1, 2, 5, 10 pounds heavier than the opposite side, to get them back into wearing normal clothing.
Before the surgery, I had to wear the compression garments, the sleeve and the hand cover. Those were causing me huge problems. I met Dr. Granzow at Harbor Hospital. They told me that you couldn't do something like that at Harbor. He happened to be walking through and he said, I'll do it. He's incredible. I was up within a couple of days walking around. It was unbelievable.
I don't run a surgical mill. I like to spend time with every one of my patients. I'll treat everybody like they're a part of my family, and I won't do anything less.
He's really compassionate. He explains everything he's doing.
You can always contact him with any questions, anytime. He's so accessible.
He always tells me anything I need, just call.
I want there to be no better result that can be achieved by anybody anywhere than what we can provide here. I've gone and I've trained around the world. There might be one person doing one procedure out in Japan, another person in Australia, or another person in Europe. I'll take the techniques that might be out there individually and be able to put them together to be able to treat all different types of patients that we see now. In plastic surgery, if you spend that time on that detail, you can see that result.
The surgery's been 4.5 years. I've had nothing come back. I don't wear a compression sleeve anymore. I'm back out on the streets.
Every day I solve problems and I make people better. I couldn't do any of this alone. We have a wonderful staff and a wonderful office and a real family that strives to make the experiences as good as possible.
I'm back to normal again.
I give everyone his information because I want them to have what I have. I have my life back.
My procedure is 100% perfect. He is the absolute best at what he does, and there's no one else in the world I could recommend higher than Dr. Granzow.